I'm Dr. Michael Frasier. I'm a physician of emergency medicine. I work here at Charles Regional Medical Center in La Plata, Maryland. I got into medical school after attending Hampton University. I went to Washington University in St. Louis. And then I realized that the operating room just really wasn't for me. I really like different patient experiences and age groups, sex groups that are just totally different. And the ER has the most because you're seeing everyone come in, don't know them. When they walk in, you have to figure out the story and exactly what's going on. It's exciting. It can be very, very just not only energizing, but it's just gratifying, especially when you give someone a new diagnosis or you help them treat a problem that's been there for a while that wasn't just quite an answer, or we can get them to the right resource. So I really like it. I originally trained at GW for residency, and after residency did some time at PG Hospital, which is now Capital Regional Medical Center. And then I spent close to 6 years, I think, at Southern Maryland Hospital Center, so I was familiar with the area from then. Growing up in Nashville, I'm a big fisherman, and so getting out in the water here, we'd hunt. So meeting a lot of locals around here and finding out where the hunting grounds are, where the good fishing spots are, and like being able to ride a dirt bike off-road and do things like that. So I'm kind of a country boy at heart, even though I've kind of got a city feel, so it just happens. So I love it working down here. I mean, the people are just real. They speak to you very nicely. They actually offer things. They'll bring you little gifts and food and things, and I love it. And so I love it down here. My philosophy is kind of an old one. My dad's a physician, and I remember being a kid kind of following him around. He's an OB/GYN, so my philosophy of care is always to treat everyone as a good friend. That way you remember that you need to care about them and things going around with them, because they're usually kind of scared or they really want an explanation. So my philosophy is really kind of be a friend who gives a good explanation and not just treats people. That way they leave knowing that they were treated for something, but also how to continue to care for it. Seeing someone go from a face of fear to a smile and laugh, yes, I mean, doesn't it make everyone feel great? We work better as a team. For instance, you're always going to get more information after you leave the room from the nurse coming back and telling you something that they learned, because they're in the room longer than we are. Text will tell you something important about having seen someone before or been around them, so it helps you with their care. And it can help you in the end to put it all together. So you kind of make it a team approach, especially at disposition when someone's going home or going to be admitted. You can sit down at that moment and you can say, hey, I heard this and I know this about you. And you have this condition, this is going on with you, we want to make sure that this happens in the future and that we can take care of this, and here's your resources to go to later, and make sure any questions get asked. I always leave the room, the last thing I ever say is, again, thank you for coming, it's Dr. Frasier, I'm glad you're feeling better, but if there's any questions you have, even if you're about to walk out the door, call me back in, I'll come and sit and speak with you.